Hi everyone, I'm Louis Brady. I'm the President and CEO at Family Health Center of Worcester. We were started in 1972 by a group of Maine South residents and city leaders with the mission to improve access to health care and reduce health disparities for the inner city residents in Maine South. And they knew to do that, they had to join the fight for social justice because you can't just address the symptoms, you have to address the causes. In the 48 years since our founding, we've grown significantly. We now serve over 30,000 individuals across the region and across a number of domains that include primary care, behavioral health, substance use disorder, dental, homeless services, WIC, OBGYN, and pharmacy, to name a few. But our impact goes well beyond patients served, individuals served. We are a source of growth and employment for 463 individuals that largely come from our communities and our city. We are an economic engine that helps to support the neighborhood and the city. And we see ourselves as an important voice in the fight for justice to this day. I was honored and pleased when in early 2019, the board of directors, of which our patients form the majority, asked me to join the organization and to lead as its fourth CEO in its history. And when I joined, honestly, my thinking was I would look for opportunities to strengthen and expand our capacity to look at opportunities for collaborations across the community that would serve our mission and serve our community and our patients. And we were making significant progress across that over the first year. And then in March of 2020, COVID hit and our world turned upside down overnight. I have to admit that me and many of our team, we lost a lot of sleep wondering how we were going to navigate the moment. We saw our patient volume drop significantly, and we needed to do that. It was the right thing to do to ensure that we protected the vulnerable and weren't contributing to the spread, and that we could treat the spread of the COVID virus appropriately. And I'm happy to say that with a little bit of luck and a little bit of good choices and a lot of help from our friends, we were able to navigate the moment. And we were able to provide care for many of our patients remotely, providing telehealth in a way that we hadn't before, and to provide delivery for our pharmacy, and to deploy a remote workforce, and to provide a level of support that went well beyond what we had done on site. Additionally, we were very proud that we were able to maintain the employment and the income of all of our teammates. It's important that we walk our talk and that we recognize our role as responsible employers in addressing that element of social justice. Now, we're looking forward at the future, and we're recognizing that we're not going to want to put the pieces back together the way they were before. We think that there's a great opportunity to do this in a new and exciting way, to be very innovative and to preserve our commitments to our core values of justice and equity and personal care, but to think about it in a very innovative way, to look at teamwork and technology to expand our impact across many, many more. And with the financial and economic devastation that we are going to be seeing over the next several months, we think that it's important that we be a force for good in that arena as well. And so we're beginning a capital campaign shortly with the expectation that we can build our capacity for the new normal, that we can expand our ability for our remote workforce, that we can expand our internal capacity to provide an even safer experience for the people who need to see us in person, and to provide the tools and the technology and the teamwork that expands our ability to meet the moment. So I hope that you will consider providing us with your support, be it financial, intellectual, or spiritual. Lastly, I'll say we started with this mission with the emphasis on a fight for social justice. And we could see that 48 years later, we still struggle. In the months since the passing of George Floyd, we know that we still continue to see the impact of injustice, the disparate impact of the COVID crisis in Worcester on our communities of color and on our most vulnerable members within the community. And we have a responsibility to stand up and to fight. We ask that you join us shoulder to shoulder in that fight and in any way that you can. So with that, I just want to say thank you for your time. If you have a desire to reach out, please reach out to me directly. My email is Louis, Louis, .Brady, B-R-A-D-Y, @fhcw.org. And I look forward to the conversation. Thank you.